Thank you for the presentation now. Tactics of the treatment of the patient with genital warts depending of the presence of contaminated infections. The next is okay. Abstract. Genital warts are one of the most clinically pronounced manifestation of human papillomavirus infection, and many authors have already referred to the group of background disease of the genitals. Given the growing prevalence of the genital warts both among women and men, and the frequent is associated with other sexual transmitted infections of the new generation, and consequently the course against background of inflammation, it is realistic to assume that despite the beginning nature of the genital warts, they are able to the participants in starting the mechanism displays the transformation of the genital tissues, especially in case where the treatment of genital warts is limited to destruction. In this regard, one of the principles of effective therapy of the genital warts is combination destruction with the antiviral therapy. Also, one of the desired goals of genital warts therapy to minimize traumatic effects and accelerate of healing time. In this regard, the purpose of the study was to optimize to the tactics of therapeutic measures relation of genital warts. The next I will material and methods of the we observed 48 non-pregnancy women diagnosed with genital warts at the age from 18 to 45 years, belonging to the socially opposite contingent of the average material income. For the microbiological characterization of the landscape of the urogenital tract, bacteriologic, microscopic, and the PCR studies of the discharge and scarring of the urogenital tract were used. For the treatment of the patients, a protocol was drawn up of the external therapy with imiquimod 5 for the free at home in the patient who did not have any associated with ascites. Patient with genital warts on the background of concomitant bacterial ascites were treatment with imiquimod against of the background of antibacterial therapy associated with the identified pathogen. Patients with concomitant herpes virus ascites were treated with imiquimod against of the background of systematic antiviral drugs, isoprenazine or valacyclovir. At the end of the bacterial antiviral treatment therapy with antifungal drugs, fluconazole was prescribed to prevent and treat candidal complication. After 4 weeks, the clinical results of local immunotherapy with imiquimod were evaluated respectively and decreased the number and the size of the warts by 25% or 50 or 100%. The remaining condylomes were subject to laser discretion using CO2 laser. A similar tract was used to reduce the amount of the traumatic effects of the discretion. Results and conclusion. Condylomes appeared for the first time in 25 patients. In the remaining 23 cases, there was a recurrent course of genital warts. Among the infections of the urogenital tract, any pathogenesis from the SAT group or from the compensation of the concomitant microflora in the from mono-infection or mixed infection were detected in 42 women examined. Pathogenesis of the SIT group were directed this necessary in one infection, Chlamydia trachomatis patients in 3, Trichomonas vaginalis in 2, Plasma urolithicum in 13, Mycoplasma genitalium in 5 in the patients. As part of the mixed or mono-infection, accompanying microbe flora was suspension in the flowing microorganisms is 12 patients and fungi of the genus Candida were detected in 5. Gardnerella vaginalis in 9. In 4 is Streptococcus gemolithicus. In 5 is Streptococcus saprophyticus, and 4 is Enterobacter. Staphylococcus aureus in 3. Streptococcus epidermis, Enterobacter, and Pyogenes Escherichia coli proteus vulgaris is 3 in patients. After the complex therapy were evaluated, the clinical and microbiological results of the treatment, which showed that conservative therapy using isolated imiquimod 5%, as well as imiquimod in combination with antibacterial, antiviral, and antifungal therapy gives the following results. It's 25% under response and disappearance in 8 patients and 50% in 18 patients and 4% in 22 patients. In general, 26 patients needs laser discretion as the end of the complex therapy, while areas number of genital warts is significant discrete in comparison with the picture during the initial treatment, which also made it possible to reduce the area discretion. Microbial agents identified before treatment were also eliminated during antibacterial therapy, which made it possible reduce of inflammatory process and accelerating healing after destruction. Genital warts relapse in the 6 months follow-up period were observed in 3 patients. Thus, comparisons associated with the clinical and microbiological background in patients with genital warts followed by adequate antibacterial, antiviral, and antifungal deployment in combination with imiquimod 5% can significantly reduce the need genital warts discretion and heal time after destruction, the number of relapses. It's the end, and thank you for the presentation for me to this about this. And the algorithm of the treatment genital warts recommended by us will significantly individual of approach of treatment, reduce the number and relapse of the disease. It can be useful for obstetric gynecologists, dermatovenerologists, and oncologists. It's my supervisor about Porsokhonova Delya Fozilovna. She's a PhD and Doctor of Medical Science, and she learned about the genital warts and dysplastic disease of the genitalia. And she, after more than 270 scientific papers about this. Thank you for the presentation.